Hello, my name is Dr. Hoon Lim, and today I want to talk about spinal decompression. You just saw the spinal decompression table, and you're probably wondering what this is for. Well, let me ask you a question. Have you been suffering from low back pain with sciatica, or neck pain with radiculopathy? We call that numbness, tingling, pain, and whatnot. Some people come into my office with the result of MRI, and their doctors already told them that they got disc bulging, or they recommended that they may need surgery, but they don't want surgery, so they come into our office. So I want to just briefly explain to you how this decompression works by showing you this vertebra. So when we say the disc situation, disc degeneration, disc bulging, and what this spinal decompression is going to do is we want to open up that disc space so the disc can regenerate. Which this approach is, spinal decompression is a little bit different from the traditional physical therapy traction that you might have already experienced, because the traditional physical therapy traction is basically, it's a traction, tractioning and stretching the muscles. And if you're just simply just tractioning, pulling, then half of the time it's possible your body might be rebelling. The muscles can rebel and the muscles are contracting, and yet the physical therapy traction is just stretching the muscles, so half the patients can become worse. Whereas this spinal decompression works like this. Basically, there's a traction, and then relax. You pull and relax, pull and relax. And so the muscles are not stretched. And in fact, the muscles will be totally relaxed, and the muscles will not get involved. And that's when the disc space will be opening up. And it creates a vacuum inside. It'll suction in any disc bulging, or it'll suction in oxygen, water, nutrients, so the disc can regenerate. And according to research, the disc can regenerate through spinal decompression. About 10 months to a year and a half later, we start seeing some signs of disc regeneration, which was never taught when I was in school 40 years ago. So the good news is that your disc can be helped, your numbness, tingling, pain down to your legs, or the numbness, tingling, and radiculopathy or pain in your arms can be corrected. It can improve by correcting the disc situation with a spinal decompression. So if you see the number below, our office number, then we can also give us a call, and then we can evaluate and find out if this pressure release therapy or spinal decompression can help you or not.